everyone, it's Dr. Keenan. So, are you tired when you wake up in the morning? If you are, you need to begin to think of the reasons what might be impacting your sleep. One hugely overlooked cause of poor daytime fatigue is disordered breathing at nighttime. So, many of you have heard of sleep apnea, and this is one of the conditions that is so widespread in the population. Many people are only thinking about it when it comes to a device that you need to help you to sleep. But I want you to think about it in a different way now. So, if you're fatigued in the morning when you wake up, and if something is impacting your ability to sleep and to breathe properly at night, this is going to have an impact not only on fatigue, but on all of your body and your nervous system. So, some of the clues that you may be having some issues at night. One of those things can be grinding. And I just had a patient and we spoke about this because she's been grinding. She broke a tooth when she saw the dentist, and he said to go out and get a mouth guard. So she went to Walmart and bought something. She's not wearing it, but a lot of it is because she didn't understand the importance of why grinding can be so significant and what it can be causing. So when you grind at night, the body is in a state of unrest. And it's in a state of unrest for many reasons. We know one of those reasons can be anxiety, but another reason can actually be sleep disorder associated with sleep apnea. And then this can come from a disordered breathing at nighttime. So in the population, we have 10 to 30% of people can have sleep apnea. So that's between 1 in 1 in 100 or 3 in 100 that may have, 10 in 100 that might have sleep apnea. So this is a lot, 1 to 3 in 10. Okay, so we have to consider what this can be doing to us. So some people are struggling with insomnia when they come to see me, and I always ask about the sleep, the quality of their sleep, what's happening when they go on. So when she told me today that she broke a tooth, then I say, okay, we need to address this because she hasn't been sleeping well for 20 years. And now it's starting to have other impacts on her health. So what does the research say? So basically, if you have sleep apnea, 30 to 50% of those people are also grinding at night. So, if you've been in to see your dentist and they've been telling you that you're wearing down your teeth, then you have room for concern. Other signs that you might be having problem with grinding or disordered sleep are if you wake up in the morning with headaches. Now, I've been a migraine sufferer for years, and I know that sometimes I would also wake up in the morning with headaches, and I do grind at nighttime. So this can be one of the issues to look at. And we have to always look backward, right? We think it can be a stress-related issue, which of course can bring on migraines and morning headaches, but what if it was your breath that was causing the issue? The other signs, so number one is a broken tooth. So if you've chipped or cracked a tooth, you have to think what is going on. So maybe it's the quality of your tooth. So maybe you don't have you have gum disease, or maybe you don't get a lot of cavities because the bacteria inside your mouth are not balanced. But maybe it's because of the way that you're breathing at night that can be impacting. So we spoke about receding gums. Now, this was a very interesting thing that I learned as well because I am a grinder, and my sleep had been very tense before because I suffered from anxiety. But as that's improved, the health of my mouth has also improved as well. But what happens with receding gums is if you're grinding at night, you're literally, or if you're not breathing well, you can be causing a pressure differential to cause your gums to recede. So that can be another warning sign. The other can be sensitive teeth. So if you're very sensitive to hot or cold, this may be because you're grinding at night. Now, other things can impact sensitive teeth as well by using your toothbrush too hard, the type of toothpaste that you use, or if you brush your teeth too close to mealtime, because we're actually meant to wait at least 30 minutes after meals to allow the natural pH of our mouth to come back into balance before we brush our teeth. But all of these can be signs that you may be grinding. And again, this sense of grinding can bring us back to disordered sleep at nighttime. So what do we do if you identify this? So maybe you're listening now and you're saying, okay, Dr. Keenan, I get migraines, I get morning headaches, and I'm wearing a bite plate at nighttime. Well, what I would say to you is number one, consider getting a sleep apnea test. So if you're in Canada, we're very fortunate because most of the sleep apnea companies will do a baseline sleep apnea test for free. Now, often it does require a referral from a physician, but you can get that tested. Now, it doesn't mean that you need to go on a sleep apnea device, but you just want to understand, are you having periods at night where your blood oxygen level is decreasing? This is very important because untreated sleep apnea is one of the greatest risk factors for sudden heart disease. But also, untreated sleep apnea is a driving factor behind high blood pressure. And this was something I talked to another patient this week about as well, that her high blood pressure may be because of her disordered breathing at nighttime. So again, get the sleep apnea test. If you're in Bermuda and or America, then you often have to go to a special sleep lab to get this done. But still, it's worth considering. Another option is if you are wearing wearables. So the Oura Ring and the Garmin watch, I would say, are some of the two best wearables that will actually track your sleep well. You can also get your sleep tracked on your Apple Watch, but it's not quite as sensitive as the Garmin or the Whoop or the Oura Ring. But that can also give you an indicator. And then what do you do? So now you found out, okay, you're grinding, you wear your bite plate, then you find out you have sleep apnea. So what do? Then you need to think about what is going on with your breathing. And this is where you may want to get a little bit of advanced help because many people we know that have trouble with their breathing, they also have anxiety. They can have issues with irritable bowel. They can have fibromyalgia, chronic fatigue syndrome. They can have chronic pain in their body, advanced arthritis pain, and a lot of this is coming from disordered breathing. So there are many ways to get help. I'll send you some link to one of the courses that can be very beneficial. It is through an organization called Oxygen Advantage, which is based in Ireland. And they have an online course that you can do, which will begin to teach you why it's important to sleep well at night, but also how you can change your daytime breathing pattern that's going to affect your nighttime breathing pattern. And the other is one of my colleagues in the UK, Dr. Louise Oliver, and she has a program designed specifically for women that have disordered breathing during the menopause transition. Because a lot of times this is when we really recognize that the breath is the culprit here. Of course, women are going through hormonal changes, but those hormones also impact your breathing. So those may be two things that you may want to look at if you're having disordered breathing and if you are diagnosed with sleep apnea. It doesn't always need to be a CPAP-based device. But if you want to hear more information or get more helpful tips and talk to me on a regular basis, please consider joining my inner circle. We meet every Tuesday, and it would be very happy to have you here so that you can learn more about your health and really to get to the root cause of disease so that you can have optimal wellness, because that's what we want. We want health, we want vitality, we want mental clarity. This is to drive you forward. I hope you all have a wonderful, wonderful day and enjoy your weekend. Bye for now.